Aging is a natural process, but as we cross the threshold of 40, our bodies begin to signal important changes that should never be overlooked. While some signs may seem like minor inconveniences, they can actually be early warnings of serious health conditions. Ignoring these symptoms can lead to bigger health problems down the road, many of which could be prevented or managed with early intervention. As you age, your body's ability to heal, recover, and function at its peak starts to decline, making it even more crucial to pay close attention to these subtle but significant warning signs. These signs or symptoms could be your body's way of telling you that something more serious is happening beneath the surface. Recognizing and addressing these signs and symptoms early can make a huge difference in treatment and overall health outcomes. If you're over 40, paying attention to these warning signs can help you prevent serious health complications, improve longevity, and maintain a better quality of life. Below are some critical symptoms that you should never ignore and the potential conditions they might be signaling. 1. Unexplained weight loss. If you are losing weight without making any changes to your diet or physical activity, it is a red flag that should never be ignored. While weight loss may seem like a good thing, especially if you've been trying to shed a few pounds, unintended weight loss can be a sign of an underlying health condition. One of the most common causes is diabetes, particularly type 2 diabetes. When blood sugar levels remain consistently high, the body is unable to use glucose efficiently for energy. Instead, it starts breaking down muscle and fat for fuel, leading to unexplained weight loss. Additional symptoms of diabetes may include excessive thirst, frequent urination, fatigue, and blurred vision. Another potential cause is hyperthyroidism, where an overactive thyroid produces excess thyroid hormones, speeding up metabolism. This can cause rapid calorie burning, even at rest, resulting in weight loss along with increased heart rate, sweating, anxiety, and difficulty sleeping. Unintentional weight loss can also be a sign of cancer, particularly cancers affecting the stomach, pancreas, lungs, or intestines. Cancer cells consume a lot of energy, causing the body to lose weight rapidly. If your weight loss is accompanied by loss of appetite, persistent fatigue, or digestive issues, it is crucial to see a doctor as soon as possible. 2. Frequent urination, especially at night. If you find yourself waking up multiple times at night to urinate, it could indicate diabetes or prostate problems. For people with diabetes, high blood sugar levels force the kidneys to work harder to remove excess glucose from the body, leading to frequent urination. Other diabetes symptoms include excessive thirst, unexplained weight loss, and slow healing wounds. For men over 40, an enlarged prostate can press against the bladder, causing urinary urgency, difficulty starting urination, and a weak urine stream. If left untreated, enlarged prostate can lead to bladder infections or kidney damage. 3. Dark or bloody stools. One of the most alarming symptoms you should never ignore after 40 is changes in stool color, especially dark, tar-like stools or visible blood in the stool. While occasional digestive changes are normal, persistent black, maroon, or bright red stools could indicate serious underlying conditions, including colon cancer, gastrointestinal bleeding, or peptic ulcers. Dark, black stools, often described as tarry, may signal internal bleeding in the upper digestive tract, such as the stomach, esophagus, or small intestine. This occurs when blood is digested as it moves through the gastrointestinal tract, resulting in a black, sticky, and foul-smelling stool known as melena. Common causes include bleeding ulcers, gastritis, which is the inflammation of the stomach lining, or even long-term use of nonsteroidal anti-inflammatory drugs like ibuprofen or aspirin, which can cause stomach bleeding. On the other hand, bright red blood in the stool may indicate bleeding from the lower digestive tract, such as the colon or rectum. While hemorrhoids or anal fissures can sometimes cause this, persistent rectal bleeding is a major warning sign of colorectal cancer. Colon cancer is often referred to as a silent killer because it can develop slowly over years with few or no symptoms until it reaches an advanced stage. 4. Memory loss and confusion. Memory loss and confusion are often dismissed as normal aging, but persistent forgetfulness could be an early sign of dementia, Alzheimer's disease, or vitamin deficiencies. Dementia gradually impairs cognitive function, causing difficulty remembering names, misplacing objects, and struggling with daily tasks. As it progresses, it can lead to disorientation, personality changes, and severe cognitive decline. However, not all memory issues stem from dementia. Vitamin B12 deficiency can mimic its symptoms, leading to brain fog, forgetfulness, and confusion. Since vitamin B12 is essential for nerve health and red blood cell production, low levels can also cause fatigue, tingling in the hands and feet, and mood disturbances. If you or a loved one is experiencing ongoing memory problems, it's important to seek medical evaluation. A simple blood test can detect vitamin deficiencies, and supplementation can often reverse symptoms. However, if cognitive decline worsens over time, a medical evaluation is necessary to rule out neurological conditions like dementia. Early intervention, whether through dietary changes, supplements, or medical treatment, can slow cognitive decline and improve brain health. Don't ignore persistent memory issues. They could be your body's way of signaling a deeper problem that needs attention. 5. Persistent fatigue. Fatigue is a common complaint as people age, but if you find yourself constantly exhausted, even after getting enough sleep, it may be a sign of an underlying health issue. One of the most serious causes of persistent fatigue is heart disease. When the heart becomes weak and struggles to pump blood efficiently, oxygen delivery to tissues decreases, making you feel tired all the time. Fatigue related to heart disease is often accompanied by shortness of breath, swelling in the legs, and chest discomfort. Another major cause is sleep apnea, a condition where breathing repeatedly stops and starts during sleep. If you wake up feeling tired, experience loud snoring, or suffer from frequent headaches, you may not be getting restful sleep. Sleep apnea is linked to high blood pressure, heart disease, and stroke, making it essential to get diagnosed and treated. Additionally, anemia, particularly iron deficiency anemia, can cause chronic fatigue, dizziness, pale skin, and shortness of breath. Anemia occurs when your body doesn't have enough healthy red blood cells to carry oxygen efficiently, leading to constant tiredness. If you experience persistent fatigue, a simple blood test can determine whether anemia is the culprit. 6. Shortness of breath. Feeling short of breath after minor physical exertion could indicate serious underlying health conditions. One major cause is chronic obstructive pulmonary disease, a progressive lung disease that makes breathing difficult due to airway obstruction. Chronic obstructive pulmonary disease symptoms include chronic coughing, wheezing, and chest tightness. Another possible cause is heart disease. When the heart struggles to pump blood efficiently, fluid can accumulate in the lungs, leading to breathlessness. This is particularly concerning if shortness of breath occurs suddenly, is accompanied by chest pain, or worsens when lying down. If you notice unusual breathlessness, especially during normal activities like walking or climbing stairs, it's essential to see a doctor. 7. Chest pain or discomfort. Chest pain is one of the most critical warning signs that should never be ignored. It can indicate a heart attack, angina, reduced blood flow to the heart, or acid reflux. Heart-related chest pain often feels like pressure, tightness, or burning, and it may spread to the arms, neck, jaw, or back. If you experience this type of pain along with shortness of breath, dizziness, or nausea, seek emergency medical attention immediately. Acid reflux can also cause burning chest pain, especially after eating spicy or fatty foods. While gastroesophageal reflux disease is less serious than heart disease, chronic acid reflux can damage the esophagus, increasing the risk of complications. 8. Joint pain and stiffness. Persistent joint pain and stiffness may seem like a normal part of aging, but they can be early signs of arthritis or osteoporosis. Osteoarthritis occurs when the protective cartilage in joints wears down, causing pain, swelling, and stiffness, especially in weight-bearing areas like the knees, hips, and back. Meanwhile, rheumatoid arthritis is an autoimmune disease that leads to chronic inflammation, joint deformities, and severe discomfort. Unlike osteoarthritis, rheumatoid arthritis often affects both sides of the body symmetrically and may come with additional symptoms like fatigue and fever. If left untreated, both conditions can lead to reduced mobility and long-term joint damage. Osteoporosis, often called the silent disease, weakens bones and increases the risk of fractures, especially in the spine, hips, and wrists. Many people don't realize they have osteoporosis until they experience sudden fractures, back pain, or a stooped posture. Women over 50 and men with low calcium, vitamin D, or testosterone levels are particularly at risk. The good news is that early intervention, including a nutrient-rich diet, regular exercise, and medical screenings, can help prevent further damage. If you experience persistent joint pain, stiffness, or unexplained fractures, it's important to seek medical attention early to protect your bone and joint health before serious complications arise. Turning 40 is a milestone, but it's also a time to pay closer attention to your health. Your body communicates with you through symptoms and warning signs, and ignoring them can lead to serious consequences. The earlier you detect a potential issue, the better your chances of preventing complications and improving long-term health. If you are experiencing any of these symptoms, don't dismiss them as just aging. Schedule a checkup and take proactive steps to protect your health and longevity. If you found this video helpful, like and subscribe for more health tips and life-saving advice.